What is architectural well-being, and how might we address it in a speculative future? The concepts of individualism, autonomy, responsibility, achievement, self-reliance, and the self. In the cultural history of Europe and North America, the concept of the individual was not as prevalent until the 19th and 20th centuries. Today, most consider themselves to be an individual, a concept celebrated and generally accepted in contemporary society. Each individual has a state of being, well or unwell. We tend to strive for a state of well-being, but then what does it consist of? When we consider the concept of the individual, well-being can be seen through three elements: the physical, the emotional, and the social. We cannot achieve a state of well-being without addressing each of these three categories. The definition of well-being is not always consistent. As times change, people's basic needs often change. Past pandemics or historical events introduced innovation to combat the issues faced by humanity. As seen in the spread of cholera in 19th century London, change was brought forward in urban sanitation and public health through the creation of sewer systems. These directed waste below the streets, preventing further spread of the disease. Currently, we are faced with the COVID pandemic. Just as the previous pandemics and outbreaks, it has brought to light a variety of issues that were previously overlooked in our contemporary built environment. As we are forced to continue within our own spaces and reconsider the intimate future, underlying issues about architectural space in which we inhabit come to light. Previously unresolved social, political, and environmental issues are now being readdressed. As we take a step back from our society in physical isolation, we are reassessing the conditions of our habitation. Temporary tracking devices have been made readily available as COVID continues across the globe. Through contact tracing, people are willing or forced to sacrifice their privacy and freedom to fight the pandemic. A mandatory face mask policy enabled through the use of artificial intelligence-based surveillance systems may be our only resort in such an unusual period. It's brought to light that we've always had these tools at hand, and with the silent nature of such technological surveillance, how can we be sure our privacy is still private? What will society become when individuals are reduced to data points and numbers on a screen? The rising need for social distancing is changing how we live in cities. With the closure of schools, offices, and some businesses, most people are working from home to try to slow the COVID-19 outbreak. That means a change in car traffic, fewer people taking transit, and an increased need for outdoor public space. How can the urban context contribute to a healthy environment that fosters well-being? Our relationship with public space in cities is brought to light during the COVID-19 outbreak. After spending more time indoors, we naturally desire a moment of removal from our interior and urban environments through a physical and mental pauses. In the pandemic, the provision of public space through quantity and quality is of increased importance. How can we rethink public space to provide a stimulating pause from the city, promoting well-being? We find ourselves in a position that brings to light our relationship with space. When we need to spend so much time in one space, we start to consider, perhaps consciously or subconsciously, the spatial effects on body and mind. In the pandemic situation of isolation, architecture ignoring spatial effects can transform the home into a necessary prison. Should the space provide for the individual, or is it rather the job of the city? What happens when this reliance system breaks down? Is the system breakdown what transforms a potential sanctuary into a potential prison? In an ideal speculative future, we reconsider the elements required for well-being and address the current issues in society. We adjust for the conditions of the current pandemic and combat underlying problems previously ignored. Four scales influence the basic relationships of architecture and individual well-being. These range from the global scale of privacy and freedom, the city scale of healthy communities, the local scale of public spaces, and the human scale of body and dwelling. To achieve architectural well-being for ourselves and those to follow, we must deeply consider the contemporary issues of our built environment. The four scales of architectural well-being pose further spatial questions still left unanswered. How will the criteria of well-being change as we slowly transition into a post-COVID future? How can we combat the ubiquitous invisibility of surveillance and social control in a technologically saturated world? Has the pandemic potentially eliminated the appeal of a central urban hub in favor of decentralization? How can the quality of outdoor public spaces encourage well-being? And finally, what effect does an architectural space have on the body and mind? How can it bolster well-being?